Hi guys, I'm Dr. Jackman, and today I'm talking about ovarian reserve testing. So I mentioned in my previous post on egg freezing part 3, so I guess this will be egg freezing part 4, ovarian reserve testing. I've mentioned about, learning about your ovarian reserve testing in your consultation with your fertility specialist when going for egg freezing consultation. So ovarian reserve testing is basically some simple tests that can tell you the approximate amount of eggs that you have left. So, as you know, or you may not know, a woman is born with all the eggs she's gonna have for life. So we actually had the most amount of eggs while we were still in our mother's womb. While our mother was still pregnant with us, that's when we had the most amount of eggs. And our eggs steadily decline as we get older. So every month, you recruit several follicles that have the potential to have eggs in it, that has eggs in it, and if you don't use it, your body only actually matures one, and the rest of them are lost. So every month, you're losing eggs from the onset of your menstruation straight till menopause. At menopause, you're more or less done. It doesn't mean that you have zero eggs. You actually have anywhere between 500 to 1,000 eggs less, but the eggs are, not good quality. You're not ovulating them. You're not releasing them into the body anymore. So back on track, ovarian reserve testing. So as I said, this is a gauge of how many eggs we have left. The thing about ovarian reserve testing is that it gives us like absolute, like total, like gives us the amount of eggs, which is quantity. It doesn't tell us quality. So unfortunately, to know if we can get pregnant, a better test would be if we had something to assess the quality of the eggs, which we don't. And then also bearing in mind, even if we had something to assess the quality of an egg, it still wouldn't fully encompass whether or not we can get pregnant, because there's several other factors besides the egg in pregnancy, be it the sperm, the tubes, the uterus ability to hold a pregnancy, so there's, and the hormone composition of the body. I just realized I have on two sets of earrings. I'm sorry if that's distracting. I'm sorry. Yeah, I was supposed to choose one. Anyway, so ovarian reserve testing gives us quantity, not quality. So when we have this, how do we know if we will actually get pregnant? The truthful answer is nothing can really tell us exactly whether or not we're going to get pregnant. The only true predictor of pregnancy is to get pregnant, and you can get pregnant because you got pregnant. There's no test that can pre-tell us. So a lot of people market this as fertility testing and pregnancy testing. It's not really the best way to market it. What it really actually tells us is how we will respond to fertility treatment. It tells us our response to IVF or egg freezing. So this test I did personally because I was going to do egg freezing, as you know. That's what the whole series is about. And I'm going to break down not the exact values I had, basically the components of the test. So one thing tested is something called Anti-Malarian Hormone, AMH. You may have heard of AMH or Anti-Malarian Hormone. This blood hormone can be done at any point in time during your menstrual cycle. It's a blood test, so you give a vial of blood and they analyze this test. Now, the AMH is produced by follicles. So every month your body produces some follicles, and the small antral follicles, the developing follicles, are the ones that will produce the AMH. Preantral follicles actually will produce the AMH, and hence this test, it can be done reliably at any point in time, and at any point in time, and it could be analyzed to determine your ovarian reserve. The good thing about this test actually is that it can tell you a little bit more. Just in addition to your ovarian reserve, it can suggest the age at which you might undergo menopause. It might be an even better predictor than your mother's age of menopause. If your value is much lower than anticipated for your age, it may suggest that you may experience menopause at an earlier age, earlier than the average age of 51 and a half. And if you have like an extremely high number, and I have an extremely high number, It may suggest PCOS, polycystic ovarian syndrome. And I do have polycystic ovarian syndrome, and I have a video on my YouTube as well as on Instagram about polycystic ovarian syndrome. Not my personal experience, but just of it in general. So AMH is a very useful test in ovarian reserve testing. Another test that we do, another blood test, is follicular stimulating hormone, FSH. This is the hormone that stimulates the ovary to produce the follicles that contains the eggs. And we do this alongside usually with estrogen, which is what is produced by the follicles. So it's the response of the follicles. If you have an extremely high FSH at the beginning of your cycle, and this one has to be done specifically at the beginning of your cycle, we usually do it on day 2 or day 3. And if you have an extremely high FSH at the beginning of your cycle, it suggests that you require so much of that hormone to produce follicles in the ovary, and hence it might suggest that, well, it suggests that you have lower ovarian reserve, meaning that your eggs are less, you have less eggs. As I said, it's quantity, not quality. One last test that we do as part of ovarian reserve testing is with an ultrasound, and it's called the antral follicle count. So in the beginning of your cycle, you would have a transvaginal ultrasound. That's an ultrasound with the probe through the vagina, and we're able to look at both ovaries and count how many follicles are developing at the beginning of the cycle. And this also gives us an indication of your ovarian reserve. So these 3 tests can be used for ovarian reserve testing. Some centers use all 3 tests. Some centers may use one or the other, or 2 or the others too. But the idea is to get an estimate of how many eggs you have left. This does not give a clear-cut indication of whether or not you are able to get pregnant, but it would help us to know what your response would be in IVF as well as in an egg freezing cycle. And as I said before, the reason why it doesn't really tell us your ability to get pregnant is because nothing really can tell us whether or not you'll get pregnant. We can assume that if you have a better ovarian reserve testing, that your ability to get pregnant may be better. And this assumption just comes from the fact that with so many eggs, we assume that you should have a good quality egg in the mix. That's not necessarily true. Likewise, having a lower reserve ovarian testing doesn't mean that you wouldn't get pregnant, because some people might have fewer but really good eggs and they will get pregnant easily. And just to bear in mind that the eggs are not the only part of the equation when it comes to pregnancy. We have the sperm, we have the tubes, we have the hormones, we have the uterus. So there are many other factors obviously involved in pregnancy that can be influenced, that can influence pregnancy outside of just the quality or quantity of your eggs. However, ovarian reserve testing is for the eggs, and it's for the quantity of the eggs, not the quality. Once again, quantity, not quality. The main predictor of the quality of what your quality of your eggs may be is honestly just really your age. So younger patients tend to have better quality eggs. Older patients tend to have less. And all these things that I'm saying, they're not absolute truths in medicine. I always preach this, and I say this almost in most of my lives and videos, is that there's no 0 or 100 in medicine. We just kind of get very close to either or, but it's nothing is 100% guaranteed, whereas as well as nothing is 100% not guaranteed. So nothing is 0 either. So 0 and 100 rarely ever exists in medicine. So you just kind of fall somewhere along the lines. So this is one of the initial testing that we get when we go for fertility treatments or monitoring. In my case, I did have ovarian reserve testing done when I was going to do my egg freezing cycle. My AMH, the Anti-Malarian Hormone, was extremely high, and I do know myself to have polycystic ovarian syndrome. I have the irregular periods, as well as I do have multiple cysts on my ovaries. These cysts are actually small follicles. They're not really what we traditionally will call cysts. It's not an actual cyst. It's just like having multiple of these follicles developing. So my AMH just kind of alluded to the fact that what I already know, that I had polycystic ovarian syndrome. Um, but it also shows that if I were to do the egg freezing, I should have had a really good response to the fertility treatment because my number was high. So as I said, remember if I said if you had like a high reserve suggested by your AMH value, that it will more predict your ability to respond to treatment. So hence, had I actually completed my cycle, I would have probably gotten a lot of eggs. We weren't able and wouldn't be able to guarantee what the quality of those eggs would be, but as I'm relatively young, it suggests that I should have had some good quality eggs had I done my egg freezing cycle, which, I didn't, and I'll explain why in a subsequent video. So my ovarian reserve testing showed lots of follicles on the antral follicle count. It had a high AMH. I had good FSH to estrogen ratio. So the response would have been a good response in terms of the quantity. As I suggested before, it tells you quantity of eggs. So I should have gotten a large number of eggs to be frozen. So I just wanted to explain what ovarian reserve testing was, what it entailed, and also to emphasize the fact of what it doesn't tell us. Okay, it doesn't tell us quality, and it doesn't tell us pregnancy. Nothing tells us pregnancy. Okay, we just use this as predictors, and it more tells us the outcome of IVF on egg freezing cycle, any sort of ovarian stimulation. It tells us the outcome of that, and the AMH value, as I mentioned before, can also give us an indication if you're going to have the possibility of having menopause at an earlier age, the possibility of experiencing primary ovarian insufficiency, and the possibility of having polycystic ovarian syndrome with the AMH value. So I just want you guys to know what it entails and what it doesn't entail so that you can be informed when you have these results. Also, these results may be better tracked as opposed to one static value, because this one static value can change. So monitoring it over time may be more beneficial than just having this one value 1, 2, 3, 4, 5 years ago. More is developing over time with the value of ovarian reserve testing and what it can and cannot do for us, but I just gave the basics of ovarian reserve testing. Feel free to comment below if you have any questions, and I will answer it as soon as I see it. Have a wonderful, wonderful day. Bye bye.